Welcome to the first lecture on maternity. In this lecture, we're going to be talking about the anatomy and physiology of the female organs, the female reproductive cycle, and influential hormones. The female reproductive system has both internal and external structures that are very important to its proper function. There are many external structures listed here, but let's focus on a few of them in particular first. The labia majora appears edematous after trauma, most particularly in instances of childbirth and rape, as it is made up of loose connective tissue and epithelium. The clitoris is a 1 to 2 centimeter round organ of erectile tissue that is sensitive to touch and temperature. It is located in the front junction of the labia minora and covered by a fold of skin known as the prepuce. This structure serves as the center of sexual arousal and orgasm in female. The Skene's and Bartlett's glands are the glands that assure sperm survival by secreting an alkaline secretion into the vagina as well as lubricating it from inside. The Furches is the site of episiotomies during delivery. The hymen may occasionally be imperforated, a condition in which the hymen is completely enclosed and the external orifice is completely shut off of the vagina. This requires a surgical incision. The perineal body is also referred to as the perineum, which is strengthened prior to childbirth by exercises such as the Kegels and squatting, tailor sitting. This is done to avoid lacerations during delivery. Our focus now to the female internal reproductive structures. First on the list is the ovaries. The ovaries manufacture, mature, and discharge the ova, which is the egg that extrudes from the ovary during ovulation. They also release estrogen and progesterone, crucial to initiating the regulation of the menstrual cycle. The ovaries often display Graafian follicle and corpus luteum on the surface in response to the menstrual cycle. The Graafian follicle is an ovum that is about to be discharged and appears clear and glistening as well as filled with fluid. The corpus luteum is the structure left after the ovum has been discharged. It also contains certain primordial and ovarian follicles in its cortex. The primordial or ovarian follicles are primitive or underdeveloped follicles. The ovaries also secrete estrogen and progesterone, as we stated before. The fallopian tubes are anatomically divided into 4 parts. The interstitial portion, which is the most proximal portion, followed by the isthmus, which is the segment of the tube that is cut or sealed during tubal ligation. Then comes the ampulla, which is the longest portion, and where fertilization of the ovum occurs, and finally the infundibular. The infundibular resembles a funnel and is covered with fimbriae that aid the ovum toward the tube. The fallopian tubes are muscular tubes or oviducts that connect the ovaries to the uterus. The fallopian tubes serve as a place where fertilization occurs and also transport the ovum to the uterus. The uterus is composed of 3 layers, and it's very important that we understand them because they execute different functions. The endometrium is a highly vascular layer that's influenced by estrogen and progesterone. In the absence of fertilization, it is this layer that is shut off monthly in menstrual discharge. But with the occurrence of fertilization, it provides an apt environment that is crucial for carrying the pregnancy to term. Always remember endo for inside. The myometrium is a layer of intricately arranged smooth muscles. Always remember M for middle. In the perimetrium, this is the outmost layer. Bear in mind that peri means periphery. The uterus is made up of smooth muscles like the heart and resembles an upside-down, uninflated balloon. The uterus is also anatomically divided into 3 parts. We have the body, which is also called the corpus or fundus, the isthmus, and the cervix.